Cancer is a word that no one wants to hear. It's people who drive our passion for cancer research and our desire to provide the world's best cancer care.
I was diagnosed with cancer when I was 19.
When someone tells you got cancer, you're going to freak out. I don't think there's a way to really soften it as such.
I was treated at MacCallum, and I consider myself lucky to have been treated there. It was a second home, and I think that word home is definitely what the staff at MacCallum created to be.
When I go back now, people are still like, "Hey, Jacques, how's it going? You look a bit different. What's been happening?" You know, they know your name. It's not just, you're not just a patient as such. It's a warm feeling when you go back.
They were always caring. They were always there to answer any question that I had.
We want to be alongside people and say, this has got to be one of the most difficult and challenging times in your life. We will not let you have to manage this alone. We will be there with you.
Working at Peter Mac is focusing on the individual in front of me. And then when I go back and reflect on that individual journey, I think, how can we improve that one journey? Because if I can do it for one, I can do it for 10. If I can do it for 10, I can do it for 100.
For us as clinicians, we have the stories of our patients that really do influence our motivation and our inspiration to try and do a better job in terms of our cancer research.
Cancer has increasingly become a part of life, no matter where you live or who you are. We have the power to challenge and change the future.
Every morning I wake up and I'm optimistic about the day ahead. Today's going to be the day where we're going to make a big breakthrough. When you're out on the track and you're running around, these are the people that hopefully aren't going to be affected by the disease, but the statistics tell you that 80% of the population will somehow be touched by cancer.
Peter Mac is a special place.
I love my job. I'm one of these people that bounce out of bed every morning. I can't wait to get into the lab. What other kind of career can you have where you can work with some of the most clever people in the country, helping to find cures for diseases and eradicate cancer?
Its vision of the best in cancer care, accelerating discovery, translating to cures, really encapsulates the way we feel about the place.
Peter Mac brings together some of the world's leading laboratory and clinical researchers under the one roof, working together to share ideas and challenge current knowledge of cancer, from the laboratory bench to patient bedside.
And that ability to work in a dynamic environment, to move up and down between clinical care and research, being able to translate that research findings into the clinical practice, using those findings to then inform further research, well, that's a very exciting environment to be in.
I ride in the elevator and I share that ride with patients, with clinicians and with other scientists. And so we are embedded within the hospital itself. We're confronted with those images every day. It reminds us of why we're here. It reminds us why we do what we do.
Every day, breaking new ground.
You should dream large, you should dream big.
Cutting-edge technology in the hands of some of the world's best surgeons for the best outcomes across all cancers.
If you take it as read that mutations in our DNA underpin every single cancer, until recently, this was a static entity that could not be fixed. We now have the technology and the ability to potentially fix it. That field, so-called genome editing, we've only just uncovered the wealth of opportunities it may present.
PET scanning plays a fundamental role in understanding not only the extent of cancer, but also the nature of cancer.
These new treatments really are quite groundbreaking, and they've really changed the landscape of cancer therapy.
We're able to deliver radiation therapy with sub-millimetre precision.
By pinpointing the tumour, it can be irradiated, and through that irradiation, the cells can be damaged, and that will enable the immune system to be recruited to come in and clear those damaged cells.
There are these exciting new technologies available called checkpoint inhibitors. These are molecules, antibodies that we can use to unleash our immune system, to release the brakes on our immune system and allow our host immune system to fight cancer.
We can detect cancer earlier and we can stop it in its tracks.
Every day, changing lives. Every day, discovering.
Peter Mac has this unique atmosphere that goes beyond the rhetoric of multidisciplinary care. It is truly about teamwork. How can we make this tolerable for this person? How can we make sure that this person has the best outcome possible?
I always tried to continue my life as normally as I could. And I think it was Peter MacCallum and the staff there that allowed that to be a possibility and were encouraging of me to do that as well.
We've made tremendous headway in areas like lung cancer with stopping people from smoking or preventing people from going out into the sun to prevent melanoma. But we need to do that across more cancers.
This wonderful building has got to be a great inspiration to bring the best minds into Peter Mac.
Peter MacCallum Cancer Centre connects Victoria, connects Australia, and connects to the world.
It certainly will open up a lot of opportunities for us in terms of collaboration, and I think that that really empowers our research.
We're going to be part of this really vibrant new precinct.
This gives us an opportunity for a game changer. We're going to pull you through in the most efficient way. We're going to connect with you in really meaningful ways, ways that are meaningful for you as an individual and your family and your support group.
Together with our partners, we are shifting the future to create a world where no one with cancer walks alone.
We want this to be the best place possible for people who find themselves needing care for cancer.
I firmly believe that we're going to get an amazing result. And I think that's a strong motivator for everyone who works here.
What makes the organisation great are the people who work in it.
We're dreaming up the next big breakthroughs here at Peter Mac. Watch this space.
Discovery is always just around the corner. Better treatments, better care, and potential cures for all cancers, for everyone.